Dealing with the issue of healthcare is a tricky thing to do. It's one of the more important industries to a lot of people since it's one of the few cases where a subpar or lack of service can result in death. If their healthcare provider isn't responsive enough or of high enough quality, it can put people at direct risk, and as such, people are often very emotionally defensive of their healthcare system, something that can easily skew the discussion. Any effective solution to the issue of healthcare needs to be easily available to as many people as possible. It needs to be highly cost effective, since any misuse of funds is going to directly affect its quality and availability. It also must be able to innovate and develop new technology, with threats to people's health evolving both literally and metaphorically every day. In the UK, we have a nationalised healthcare system, the NHS, in which finances are forcibly taxed from the population, and from that a set budget is provided to the NHS, and then they are tasked with providing entirely universal healthcare to the population that is available to anyone as and when they need it. As an unfortunate side effect of paying for healthcare through forced taxation, in which everyone is told that they have either A. already paid for their healthcare, or B. that healthcare is free, is that they will not hesitate to use the service, even in cases where they wouldn't have if they were expected to pay the actual costs of what they were using, especially if you've been taxed to pay for it, since you've already lost the money and aren't going to get it refunded if you don't use it. This leads to a heavily overused and stressed system. The funding for a nationalised healthcare system is also never going to be able to provide the supply needed to meet its artificially inflated demand. For one, any increase in taxation to pay for the increased demand is going to be met by a further increase in demand, with the people now paying more, expecting more, and being incentivised to use the service more to justify the cost. A lot of the funding it does get is going to be wasted as well. A nationalised healthcare system rarely exists somewhere that doesn't already have very heavy regulation of the healthcare market, and with regulation comes paperwork, licence fees, quotas, along with a host of managers and bureaucrats to fulfil all of those requirements. Especially so in a nationalised system that is always going to be trying to prove that they are doing things properly. A lot of this overhead is needless and directs funding away from actual services, putting further stress on the system and artificially inflating the cost of healthcare. To be fair to the NHS itself, it isn't to blame. These are all side effects of monopoly, because that's what nationalised healthcare is. Everyone is forced to be a customer of the NHS. If you are taxed, you fund it. Even if you use the service or not, you're paying. Even if you go to a private third party, you still pay for the NHS. And as such, there is no incentive at all to improve the service provided or be more cost effective. They aren't going to win more customers, since everyone is a customer, and they don't want to incentivize any more frequent use of their services. If anything, the incentive is to waste the money and try to ask for a bigger budget next year, especially since if they have the funds left over, they may have their budget cut next year. As some side notes regarding the NHS, people talk a lot about the NHS becoming more privatised, and that this impacts it negatively. The thing is that the NHS itself isn't becoming private, it is instead contracting out certain supply of goods and services to private companies. The problem is that because the NHS is a monopoly, and therefore the only demand for those goods and services, the private companies they use become effective monopolies themselves, presenting all the usual problems with excessive cost and low quality service. The other side note is that people talk about the NHS suffering from budget cuts. This is more of a political point-scoring exercise and is based on very careful wording. The NHS budget increases almost every year without fail. When people talk about the budget being cut, what they mean is that the increase itself is cut, not the overall amount of money in the budget. Whenever the NHS is questioned, most of the rebuttals are rooted in a false dichotomy between the NHS and the US insurance-based system. Contrary to popular belief, there are more places in the world than the UK and the US, and there's also more than two ways of doing healthcare. The US system is much worse in many ways, but better in a lot of others. The US system is based around a heavily regulated market of insurance providers. Due to the large amount of regulation, a lot of the same issues as with the NHS are present, mostly the added overhead costs of meeting regulations and licensing requirements, that then get passed on to the customer and drive up the price massively, as well as raising the barrier to entry for new companies or individuals to enter the market, and lowering the amount of competition in the market by a significant degree. The market also has a problem with intellectual property laws allowing manufacturers of new drugs or equipment to maintain a monopoly over them, and therefore further increase the cost of healthcare as well as stifling innovation by preventing others from creating more effective or efficient versions of the new drugs and equipment. Alongside the issues with the cost, incentivized and necessitated by government regulation, there is also the issue of lobbying, with larger organizations putting pressure on the government to regulate their market further, putting smaller competitors out of business when they can't afford to follow the new regulations, as well as even further raising the barrier to entry. These new costs will again be passed on to the customer, leading to a near unaffordable service. So this brings me to the point that a competitive free market healthcare system would provide a better service than the NHS at a far lower cost than the US's regulated insurance-based system. Starting with the cost, a free market of providers requires that, to continue generating a profit, each provider must offer a service that is competitive with the others. Everyone will be working to try and provide healthcare as cost-effectively as possible without compromising on quality, and if they do compromise, they'll lose those customers to their competitors. When your livelihood depends entirely on offering either a better service, a cheaper service, or even both, you have that incentive not to waste money or overspend, since wasted money won't be just provided again next year in a budget. This is the fundamental difference between the free market incentives and those of social programs. If people don't like them, they can go somewhere else and not be out of pocket. This competition also inspires the innovation needed to combat new health threats, as well as optimize treatment for current ones. Everyone will be looking to be the first to find new cures or to find better and more cost-effective ways of treating existing issues, since it will give them a short-term edge over their competition, and without the intellectual property regulations, other companies will be easily able to produce the same or derived versions of new innovations and keep the pricing competitive and steadily reducing over time. The way the industry will change when it's no longer pre-planned is also impossible to tell. Just as an example, it may turn out more profitable to develop home treatments that can be purchased and self-applied, since you no longer need to employ the staff or pay for a hospital to house them. Obviously, not currently possible for many things, but nobody knows what the future may hold. This rapid innovation is also integral to the free market argument. One of the things that we can roughly tell with the current statistics is how many people may have died or been severely affected by not being able to gain access to available treatments they need. What we cannot tell, however, is just how many people have suffered or died as a result of treatments never being developed due to government regulations stifling innovation. The free market also gives you a choice and more mobility. You aren't forced to pay for the state monopoly and can take your money wherever you like. You could have a cheap and basic insurance policy, a high-quality policy with all the bells and whistles, or simply pay as and when you want to use the service. You aren't stuck in the single available quality, you don't have to pay twice to get the better quality service, and as such, countless people would end up being able to afford far better care than they can now. Of course, the final argument that socialised healthcare falls back to is the simple and emotional appeal, but what happens to the people who cannot afford any care? First, we must conclude that since healthcare in a free market is always going to be driving down prices and driving up effectiveness, the number of people that cannot afford care is going to be constantly decreasing. Let's talk purely about those who cannot ever afford any healthcare at all. The presumption is, of course, that they would suffer greatly as a result and perhaps even die. Before going any further, it's worth pointing out that this happens in every healthcare system. In market systems, it's to people who cannot afford care. In state systems, it's to people who end up on waiting lists for treatment due to the massive overuse of the service. The only practical difference is whether the people denied care is due to the lack of economic success or due to random placement on a list. I don't, however, believe that many people would end up in those situations in a free market, as there are still a few factors we haven't considered. One is another incentive provided by the market itself, public relations. Reducing cost and increasing quality of service won't win you customers if you have a bad public image, and nothing looks worse than someone dying outside of your facility because you refuse to help them. By offering some treatment for free to people who cannot afford it, they will make gains in the long term from customers gained through the improved public perception. There would undoubtedly be promotions by healthcare providers for this exact reason. Even then, it's inevitable that some people will end up going without treatment. Resources are only finite after all, and not everyone can have everything. It's a reality of the world. It's also not ethical to forcibly take money from people to pay for other people's healthcare, because they may need that money for their own treatment down the line. they will lose out on what they worked hard and earned by every definition of the word. The other simple answer to this problem is just the fact that a lot of people care about making sure everyone receives healthcare. If they didn't, after all, the NHS wouldn't be popular in the first place and therefore wouldn't exist. Charities would certainly be prevalent in a free market as a result of this, and people, once they had earned enough for their own care, would be able to voluntarily give to help those who can't earn enough, and if you wouldn't donate to charities voluntarily, you certainly have no grounds for suggesting that everyone should be forced to, which is what the NHS is. As for how to reach a free market from this point of nationalisation, an intermediary step in a potentially French-style system would likely work well. The French system is consistently ranked as one of, if not the, best in the world. With non-profit insurance and a mixed market including private and public healthcare providers, this system still lacks a lot of the advantages of a free market, but does have far more competition since the customers choose the providers, forcing them to create the best possible service within the still state-regulated pricing. To summarise, a heavily regulated or nationalised healthcare system, as with all government services, suffers from waste, inefficiency, and all of the problems of monopoly. It can still provide a service, but not at the quality or effectiveness of a free market, and when it's a service we all have a demand for, simply to survive, that loss of quality is always going to be extremely costly.